Okay, we were fixing to talk about Chapter 1, Objective 7, which is discussing the various imaging techniques. There are actually 5 imaging techniques that we're going to discuss rather than 4. Sorry about that. Okay, so first of all, what is medical imaging? Medical imaging is non-surgical ways to look inside the human body. Years ago, if they had a question about what was going on inside of the human body, they would just do like exploratory surgery. Now they can do, without actually opening the body up, they can use non-surgical techniques, imaging, to figure out what's going on. It's going to create images of different parts of the body based on what it is they're trying to see. So these can help with screening for possible health conditions before symptoms appear, such as getting mammograms to detect for cancer, diagnose the likely cause of existing symptoms. So if someone comes in and they have symptoms and the doctor can't figure out what's going on, they will do imaging techniques to see if they can figure out what the cause of the symptoms are, monitor health conditions that have been diagnosed, or the effects of treatment for them. So in other words, if someone's been diagnosed with cancer, they can actually use imaging to see if the treatment is working or not. Imaging, also known as radiology, and the doctors who specialize in that are radiologists. So the 5 types of imaging that we're going to take a look at are X-rays, CT scan, MRI, a specific type of nuclear medicine image, which is a PET scan. Now that's a pretty broad category. We're just going to look at PET scans under that category, okay? And then ultrasounds. So what you're going to need to be able to do for the test is there's going to be a description for each one of these, along with advantages and disadvantages. So you need to take a look at all of that. For each one of these, there's a short little video clip that's embedded in the PowerPoint that you're welcome to click on. So I'm not actually going to click on those, but you're welcome to do that. If you go back and look at the PowerPoint, you can click on those and they're just about 1-minute videos you can take a look at. So X-rays, they're used to view hard body structures. So in other words, this is going to be from a lot of bone. You're not going to get a lot of soft tissue information from an X-ray. Advantages of X-rays: quick, non-invasive, painless, diagnose disease and injury, including cancer and infections. What are some disadvantages? X-rays expose you to small amounts of radiation. Now, X-rays are considered high energy particles. And anytime these high energy particles hit a cell, they can cause damage to the DNA, resulting in mutations, resulting in cancer. X-rays have enough energy to be able to penetrate the cell, the nucleus, and the DNA and make those mutations. So they are considered high energy and dangerous. That's why when you go and get an X-ray, they'll put like a lead vest on you, especially covering reproductive organs and things like that, so damage doesn't occur to those cells. These are just some examples of some X-rays. So you've got a broken bone up here in the upper right-hand corner of the screen, and then in the lower left-hand corner, you can see that it's detecting cancer. It's just kind of a area there that's a little bit denser than the rest of the tissue around, so it shows up on the X-ray. CT scans, again, another video for you to watch. CT scans, also called computed tomography, and some people call them CAT scans. CAT scans use X-rays, but instead of using a single X-ray, they use several X-rays. So instead of getting exposed to just one X-ray, like in the previous section, you're getting exposed to that same X-ray radiation, but more of it. So it's more dangerous. Again, those X-rays are still high energy radiation. This is still going to show, because it's X-rays, bones, tumors, organs, tissues, of various parts of the body. What are some advantages and disadvantages of CT scans? Quick, painless, diagnose and guide treatment. Awesome. Disadvantages. Again, there is a risk of cancer because you're being exposed to this high energy radiation. Sometimes they have to use a contrast to be able to see. So you can have like a CT scan with contrast or a CT scan without contrast. And that's just to help visualize a little bit better on the outcome. Some people don't tolerate the contrast well. So that's where there could be some issues. And also, you are inside of a tube. So sometimes people don't handle that kind of claustrophobic situation well. And you're in there for, a good little amount of time, 15, 20 minutes, maybe 30 minutes. And if it's a young child or an older adult, maybe with some dementia, they may have a hard time sitting still for that long. MRIs, also known as magnetic resonance imaging. Now, MRIs utilize a magnetic field and radio waves. Both of these are low energy particles, so they do not damage cells. These are safe, unlike X-rays, which are potentially dangerous. These show detailed image of organs, soft tissues, bone, ligaments, cartilage, basically the same thing a CT scan shows. Advantages: do not expose the patient to harmful radiation, so that's a good thing. Usually non-invasive and painless, diagnose, guide treatment, similar information to what you're going to find in a CT scan. So why would you choose a CT scan, which is going to expose you to harmful X-ray radiation, versus a safer MRI scan? Sometimes MRIs are more expensive and your insurance company doesn't want to pay for it, so that could be part of it. They do tend to be more lengthy and fairly noisy. Those magnets trying to get aligned just right tend to be super noisy. So again, if you're dealing with a small child, it could be kind of scary. The patient's got to remain still. These could be like 45-minute long procedures where you're in a tube. So you got that claustrophobic component. So sedation could be required. There could be MRIs with contrast, MRIs without contrast. So if they have to inject that into your veins, that could be a little bit of cause of an allergic reaction in some people. So not all situations allow for an MRI. In other words, if somebody's got a pacemaker or metal implants, that may not work for an MRI because, again, you're dealing with magnets. Another one is a PET scan, which is a type of nuclear medical imaging technique. PET scan stands for positron emission tomography. This one uses radiopharmaceuticals, which also emit radiation. Where the X-rays have high energy particles, these are super high energy particles. They're gamma rays. So these have even more energy than the X-ray does. So these are even more dangerous. Now, how do you get these radiopharmaceuticals inside your body? Depending on what body system they're trying to look at, they could be injected into veins, they could be inhaled if they're doing respiratory study, they could be swallowed if they're doing a digestive study. Now, this is kind of interesting because unlike the other medical imaging techniques, this one actually looks at physiological activity. So it can show blood flow, it can show movement, as opposed to still images such as bones and organs. Again, usually painless, treat a wide range of conditions, show how different parts of the body are actually working, and it can detect the spread of cancer. So good things there. Disadvantages, again, exposure to those high energy particles, more so than a CT scan. Could require sedation. You're still inside of a tube, so it's claustrophobic. And again, there could be an allergic reaction to what they're injecting. This is just showing the results of a PET scan. So you've got a normal brain, you've got this dark area here in that mild cognitive impairment area, and that just shows, there's nothing going on right there in that dark area, which is not a good thing. And then with Alzheimer's, you can see a lot of those areas are no longer functioning. So that's results you would see from a PET scan. Another type of situation is if you're looking at a cancer. This is looking at, you've got the vertebra in the back. So this is the front of the patient. This would be a transverse cut, let's say, going from right to left. So you're looking at the bottom, transverse cuts divide the body into top and bottom. You're looking more, down the bottom of the body. So you can see the lungs and the kidneys and such. In a CT scan, you can see barely, it's just a little faded area right there. that's representing where the cancer is. Now, if that same image was done using a PET scan, it really lights up dramatically. So there's no question there's something going on in that area. Now, an ultrasound, as opposed to putting somebody in a tube and having the scanner and detector go around you, this one is using a wand type device. So it sends out ultrasounds, they bounce off of a hard surface and come back. And they're timing how long it takes to do that. And also, depending on what those sound waves have to pass through, such as are they passing through fat? Are they passing through fluid like urine? Are they passing through gas, maybe in the stomach or intestinal area? Those sound waves are going to travel different through each of those mediums. And once they hit a hard surface, such as bone, bounce back, and it's timing how long it takes to get back, an image is produced on a computer. So this is able to detect, again, really interesting, heart flow, actual physiological activity, blood flow, fetal growth. Ultrasounds are non-invasive because they're dealing with sound waves. There's no radiation, so they're safe. No injection is usually needed. They help diagnose disease and they monitor and check on the health of the baby during pregnancy. Disadvantages: the resolution isn't going to be as good. Okay, X-rays have a better resolution. Bone absorbs the ultrasounds, so you couldn't see anything that's like sitting behind a bone. For instance, you can't look at the brain because it's behind the cranial bones, so that's not going to be an option. Obesity, again, sound waves are going to move different through fat, and that's going to be more difficult to pick up that image. Presence of gas, these sound waves are meant to be traveling through fluid. That's why they usually tell you, you need to get your ultrasound if you're going in for a baby check with a full bladder. Very uncomfortable, but the sound waves travel really well through fluid, not so much through fat and gas. Okay, so it makes the image a little bit less effective. Okay, this would be an example question that you could have, just to kind of give you an idea how the question could be worded on the test. Exposure to gamma rays is a disadvantage of which imaging technique? So CT scan, remember this used X-rays, many X-rays as opposed to just a single. MRI uses radio waves. Ultrasound uses sound waves. The PET scan uses gamma rays. So D is the right answer. And another example question, magnetic resonance imaging, also known as MRI, makes use of what? X-rays? Nope, that was a CT scan. This is kind of the same question but backwards. Radio waves? Yes. Radioisotopes? This was a PET scan. High frequency sound waves? This was an ultrasound. So the right answer in this case was B. Okay. And that's it.